Chapter 38. Stress and Coping. In the presence of physical and/or mental illness, stress affects the entire family. Therefore, the family and patient's health care needs must be considered in the plan of care. Equally important, healthcare professionals also experience stressful events in the course of clinical practice and their own lives. Nurses need to recognize the signs and symptoms of stress and understand stress management techniques to aid personal coping and design stress management interventions for patients and families. The term stress is used in many ways. Most commonly, it is a term describing a process beginning with an event that evokes a degree of tension or anxiety. Such events are referred to as stressors. Stressors are tension-producing stimuli operating within or on any system. Appraisal is how a person interprets the impact of the stressor. It is also a personal evaluation of the meaning of the event on what is happening, and a consideration of the resources on hand to help manage the stressor. Stress is a physical, emotional, or psychological demand that can lead to personal growth or overwhelm a person and lead to illness or worsening of existing acute or chronic illnesses. When stress overwhelms existing coping mechanisms, patients lose emotional balance, and a crisis results. If symptoms of stress persist beyond the duration of the stressor, a person has experienced a trauma. Scientific-based knowledge. The initial response to stress involves activation of the sympathetic system, a pattern known as the fight or flight response. Neuroendocrine responses to stress function through negative feedback. The process of negative feedback senses an abnormal state, for example a lowered body temperature, and then makes an adaptive response such as initiating shivering to generate body heat. Neurophysiological responses to stress function through negative feedback. Three structures control the response of the body to a stressor. 1. The medulla oblongata. 2. The reticular formation. And 3. The pituitary gland. The medulla oblongata controls heart rate, blood pressure, and respiration. Impulses traveling to and from the medulla oblongata increase or decrease these vital functions. The reticular formation, a small cluster of neurons in the brainstem and spinal cord, continuously monitors the physiological status of the body through sensory and motor tracts. The pituitary gland, a small gland attached to the hypothalamus, produces hormones necessary for adaptation to stress such as adrenocorticotropic hormone, which in turn produces cortisol. The pituitary gland regulates the secretion of thyroid, gonadal, and parathyroid hormones, shown as Figure 38-1, fight or flight response. For a more in-depth review, please review your anatomy and physiology textbook as a supplement to this PowerPoint. General Adaptation Syndrome. The General Adaptation Syndrome describes how the body responds physiologically to stressors through three stages. 1. Alarm. 2. Resistance and 3. Exhaustion. The general adaptive syndrome is triggered either directly by a physical event or indirectly by a psychological event. It involves several body systems, especially the neuroendocrine feedback, and responds immediately to stress. When the body encounters a physical demand such as an injury, the pituitary gland initiates the general adaptive syndrome. A fundamental concept underlying this reaction is that the body will attempt to return to a state of balance, a process referred to as allostasis. During the alarm stage, the central nervous system is aroused and the body's defenses are mobilized. This is the flight or fight reaction. Rising hormone levels result in increased blood volume, blood glucose levels, epinephrine and norepinephrine amounts, heart rate, blood flow to muscles, oxygen intake, and mental alertness. If the stressor poses an extreme threat to life or remains for a long time, the person progresses to the second stage, resistance. The resistance stage also contributes to the flight or fight response, and the body stabilizes and responds in an attempt to compensate for the changes induced by the alarm stage. Hormone levels, heart rate, blood pressure, and cardiac output should return to normal, and the body tries to repair any damage that occurred. These compensation attempts consume energy and other bodily resources. The exhaustion stage is where continuous stress causes progressive breakdown of compensatory mechanisms. This occurs when the body is no longer able to resist the effects of the stressor and has depleted the energy necessary to maintain adaptation. The physiological response has intensified, but the person's ability to adapt to the stressor diminishes. Even in the face of chronic demands, an ongoing state of chronic activation can occur. This chronic arousal with the presence of powerful hormones causes excessive wear and tear on bodily organs and is called allostatic load. A persistent allostatic load can cause long-term physiological problems such as chronic hypertension, depression, sleep deprivation, chronic fatigue syndrome, and autoimmune disorders. Shown on this slide is Figure 38-2, General Adaptation Syndrome. Time for a quick quiz. You are a nurse working in the College Student Health Center. You receive a call that an athlete has just fallen and has been injured. You know that according to the General Adaptation Syndrome, the athlete will be exhibiting A. An increased appetite, B. An increased heart rate, C. A decrease in perspiration, or D. A decrease in respiratory rate. The answer is B. An increased heart rate. During the alarm stage, rising hormone levels result in increased blood volume, blood glucose levels, epinephrine and norepinephrine amounts, heart rate, blood flow to muscles, oxygen intake and mental alertness. Stress causes prolonged changes in the immune system, which can result in impaired immune function. With these increases, the person is more susceptible to changes in health, such as increased risk for infection, high blood pressure, diabetes, and cancers. The general adaptation syndrome is activated indirectly in the face of psychological threats, which are different for each person and produce differing reactions. Whether or not the person anticipated the stressor influences its effect. Personal characteristics that influence the response to a stressor include the level of personal control, presence of a social support system, and feelings of competence. Evaluating an event in terms of personal meaning is primary appraisal, when a person is also considering possible coping strategies or resources available to help deal with the event. This process is referred to as secondary appraisal. Coping is the person's cognitive and behavioral efforts to manage a stressor. Coping is important to physical and psychological health, because stress is associated with a range of psychological and health outcomes. Effectiveness of coping strategies depends on the individual's needs. In stressful situations, most people use a combination of problem and emotion-focused coping strategies. The type of stress, people's goals, their beliefs about themselves and the world, and personal resources determine how people cope with stress. Ego defense mechanisms regulate emotional distress and thus give a person protection from anxiety and stress. Ego defense mechanisms help a person cope with stress indirectly and offer psychological protection from a stressful event. Please review Box 38-1. Examples of ego defense mechanisms. as a supplement to this PowerPoint. Case study: Rachel Bennett is a 32-year-old married mother of 3 children and works as the nurse manager in a medical intensive care unit. Recently, patient and staff satisfaction has been declining, and Rachel feels pressured to improve the satisfaction scores. In addition, within the past year, Rachel's husband has had several hospitalizations related to heart disease, and he is unable to work. What stressors can you anticipate for Rachel Bennett? Types of stress. Stress includes work, family, chronic and acute stressors, daily hassles, trauma, and crisis. Chronic stress occurs in stable conditions and results from stressful roles. Living with a long-term illness produces chronic stress. Time-limited events that threaten a person for a relatively brief period provoke acute stress. Case study continued. Until recently, Rachel has felt very happy with her job. For the past 6 weeks, she has been feeling defeated and hopeless. She has no energy, and she has difficulty organizing her thoughts. When her supervisor noticed Rachel's frequent severe headaches, reported lack of sleep, and use of wine at night to relax, she referred her to the hospital's employee health office to help her cope with her stress. Types of stress. Post-traumatic stress disorder, or PTSD, begins when a person experiences, witnesses, or is confronted with a traumatic event and responds with intense fear or helplessness. Anxiety associated with PTSD is sometimes manifested by nightmares and emotional detachment. Some people with PTSD experience flashbacks, or recurrent and intrusive recollections of the event. Depression and PTSD commonly occur together. Acute stress disorder is a similar diagnosis that differs from PTSD in duration of symptoms. Types of crisis. A crisis implies that a person is facing a turning point in life. There are 3 types of crises. 1. Maturational or developmental crises. 2. Situational crises. And 3. Disasters or adventitious crises. Developmental crises occur as a person moves through the stages of life. External sources such as a job change, a motor vehicle crash, a death, or severe illness provoke situational crises. A major natural disaster, man-made disaster, or crime of violence often creates an adventitious crisis. Patient-centered care provides an important context for crisis intervention. Time for a quick quiz. A patient comes into the emergency department complaining of chest pain. When discussing possible reasons why the chest pain has occurred, the nurse learns that the patient is depressed because of the loss of a job. This type of crisis can be classified as A. Maturational, B. Situational, C. Sociocultural, or D. Post-traumatic. The answer is B. Situational crisis. External sources such as a job change, a motor vehicle crash, a death, or severe illness provoke situational crisis. Nursing theory and the role of stress. A systems approach explains that a stressor at one place in a system affects other parts of the system. A system is a person, family, or community. Events are multidimensional and not caused or affected by only one thing. Every person develops a set of responses to stress that constitute what is considered the normal line of defense. This line of defense helps to maintain health and wellness. Physiological, psychological, sociocultural, developmental, or spiritual influences buffer stress. The Newman Systems model of nursing views a patient, family, or community as constantly changing in response to the environment and stressors. In the Pender model, people want to live in ways that enable them to be as healthy as possible and capable of assessing their own abilities and assets. Interventions such as increasing physical activity, improving diet and nutrition, and using stress management strategies help the individual become healthy and remain healthy. Potential stressors and coping mechanisms vary across the lifespan. The appraisal of stressors, the amount and type of social support, and coping strategies all balance when assessing stress, and depend on previous life experiences. Work stress for nurses and other healthcare professionals happens with patient load, distractions, conflicting priorities, intensity of care, such as trauma, emergency or critical care areas, other job-related proactive coping strategies, such as resilience training for nurses working with trauma and critically ill patients, prepare nurses for the critical situation, provide time to practice stress management techniques and reduce job-related stress. Stressors also vary with life stage. Children identify stressors related to physical appearance, families, friends, and school. Pre-adolescents experience stress related to self-esteem issues, changing family structure as a result of divorce or death of a parent, or hospitalizations. As adolescents search for identity with peer groups and separate from their families, they experience stress. Stress for adults typically centers around major changes in life circumstances. In the older adult, stressors include the loss of autonomy and mastery resulting from general frailty or health problems that limit stamina, strength, and cognition. Potential stressors that affect any age group, but which are especially stressful for young people, include prolonged poverty and physical handicap. A person's culture also influences stress and coping, such as with gender roles, family relationships, and religious beliefs. Additionally, language difference, geographical location, family relationships, time orientation, access to health care programs, and disparities in health care all influence stress. Please review Box 38-2. Focus on older adults, understanding differences in stress and coping among older adults, and Box 38-3. Cultural aspects of care, cultural variations in stress appraisal and coping strategies, as a supplement to this PowerPoint. When caring for a patient experiencing stress, use critical thinking skills to understand the patient's stressor and the stress response. Know the neurophysiological changes that are related to the general adaptation syndrome. If the patient's usual coping skills have not helped or his or her support systems have failed, use crisis intervention counseling. Integrity is an essential attitude through which you respect the patient's perception of the stressor. Make the effort to have the patient explain his or her unique viewpoint and situation. Use linguistic and culturally effective communication skills to clearly and precisely understand a patient's perception of stress. The patient expects you to exhibit confidence and integrity when he or she feels vulnerable. Be especially aware of the ethical responsibility in caring for someone who has diminished autonomy as a result of stress. Be confident in the belief that you and your patients can effectively manage stress. Impaired patients rely on you as the expert. Nursing process, assessment. Establish a trusting nurse-patient relationship. Gather information, Ask questions and make observations of nonverbal behavior. Ask open-ended questions. Take time to understand a patient's meaning of the precipitating event and the ways in which stress is affecting his or her life. Allow time for him or her to express priorities for coping with stress. Gaining an understanding of patient expectations does not mean excluding certain types of care that are important simply because a patient does not identify them as needs. Subjective findings include information that you receive by talking with a patient. Use the interview to determine the patient's view of the stress, coping resources, any possible maladaptive coping, and adherence to prescribed medical recommendations such as medication or diet. Objective findings include information that you observe. Observe grooming and hygiene, gait, characteristics of the handshake, actions while sitting, quality of speech, eye contact, and the attitude of the patient during the interview. Please review Box 38-4, Nursing Assessment Questions, and Figure 38-3, Critical Thinking Model for Stress and Coping Assessment, as a supplement to this PowerPoint. Case study continued. Becky Howard, a nurse practitioner in the Employee Health Office, does preliminary screening and crisis intervention with staff members experiencing stress and potential substance abuse problems. Becky wants to be thorough in assessing the responses and symptoms Rachel has been experiencing. What is important information that Becky should include in her assessment of Rachel's stress? Becky should include the following in her assessment. Observe for signs of stress. Measure vital signs. Ask Rachel about recent weight loss. Ask Rachel about changes in sleep. Assess Rachel's perception to stress. Ask Rachel about her current coping mechanisms. Nursing process. Diagnosis. Nursing diagnoses for people experiencing stress generally focus on coping. Specifically, major defining characteristics of ineffective coping include verbalization of an inability to cope and an inability to ask for help. To identify defining characteristics, ask the patient what is of most concern at the time of the interview. It is important to allow him or her sufficient time to answer. Observe for nonverbal signs of anxiety, fear, anger, irritability, and tension in a patient who is experiencing ineffective coping. Other defining characteristics include the presence of life stress, an inability to meet role expectations and basic needs, alteration in societal participation, self-destructive behavior, change in usual communication patterns, high rate of accidents, excessive food intake, drinking, smoking, and sleep disturbances. Listed on this slide are examples of potential nursing diagnosis for patients experiencing stress. Please review Box 38-5, Nursing Diagnostic Process, as a supplement to this PowerPoint. Case study continued. During her assessment, Becky observes that Rachel fidgets, uses poor eye contact, and bursts into tears and expresses feelings of being overwhelmed. Rachel's vital signs show changes in response to stress. She has lost weight and has trouble sleeping. She expresses shame at not coping better and admits to drinking at night to unwind. A possible nursing diagnosis for Becky could include ineffective coping related to increased pressure at work and multiple family stressors, as evidenced by poor eye contact, fidgeting, and voicing feelings of being overwhelmed. Nursing process, planning. The nurse often selects interventions for stress and improved coping, such as coping enhancement and crisis intervention. Interventions should be individualized after carefully considering the nursing diagnosis, the resources available to the patient, and the goals identified by the patient and the nurse. Nursing interventions are designed within the framework of primary, secondary, and tertiary prevention. At the primary level of prevention, you direct nursing activities to identifying individuals and populations who are possibly at risk for stress. Nursing interventions at the secondary level include actions directed at symptoms such as protecting the patient from self-harm. Tertiary level interventions assist the patient in readapting and can include relaxation training and time management training. The nurse and the patient assess the level and source of the existing stress and determine the appropriate points for intervention to reduce it. Use a concept map to identify multiple nursing diagnoses from the assessment database and show how they are related. Interventions focus on a partnership with the patient and support system, usually the family. Consider the patient's perspective and responses to assessment questions when setting priorities for care. As in all areas of nursing, safety of the patient and others is the first priority. When you have completed immediate assessment and ensured safety, begin the problem-solving process. To effectively plan individualized care, collaborate with occupational therapists, dietitians, pastoral care professionals, and healthcare professionals from other clinical specialties, depending on the patient's situation. Recognize the need for collaboration and consultation, inform the patient about potential resources, and make arrangements for interventions such as consultations, group sessions, or therapy as needed. Please review Figure 38-4. Critical Thinking Model for Stress and Coping Planning, and Figure 38-5, Concept Map for Carl, as a supplement to this PowerPoint. Case study continued. Becky's goal is that Rachel will manage the stressors that have been taxing her individual resources. What do you think the expected outcomes would include? Expected outcomes should include: Rachel will differentiate effective and ineffective coping patterns. Rachel will verbalize a decrease in stress. Rachel will modify her lifestyle to reduce stress. Rachel will use her personal support system. And Rachel will verbalize the need for assistance. Nursing process. Implementation. 3 primary modes of intervention for stress are to decrease stress-producing situations, increase resistance to stress, and learn skills that reduce the physiological response to stress. Educate patients and families about the importance of health promotion. A regular exercise program improves muscle tone and posture, controls weight, reduces tension, and promotes relaxation. In addition, exercise reduces the risk of cardiovascular disease and improves cardiopulmonary functioning. Patients who have a history of a chronic illness, are at risk for developing an illness, or are older than 35 years of age should begin a physical exercise program only after discussing the plan with a healthcare provider. Patients and family members who are well rested are able to manage stress, problem solve, and maintain a sense of control over the situation. Please review Box 38-6, Patient Teaching, Stress Management, as a supplement to this PowerPoint. Time management techniques include developing lists of prioritized tasks. Guided imagery is based on the belief that a person significantly reduces stress with imagination. It is a relaxed state in which a person actively uses imagination in a way that allows visualization of a soothing, peaceful setting. Progressive muscle relaxation therapies diminish physiological tension through a systematic approach to releasing tension in major muscle groups. Assertiveness includes skills for helping individuals communicate effectively regarding their needs and desires. The ability to resolve conflict with others through assertiveness training is important for reducing stress. For many people, keeping a private, personal journal provides a therapeutic outlet for stress. Mindfulness is a moment-to-moment present awareness with an attitude on non-judgment, acceptance, and openness. Through mindfulness exercises, people learn to self-regulate awareness and attention to feeling and implement effective changes. Stressors such as rapid changes in healthcare technology, diversity in the workforce, organizational restructuring, and changing work systems place stress on employees. Burnout occurs as a result of chronic stress. In nursing, burnout frequently results from intense caregiving and manifests as emotional exhaustion, loss of a sense of personal identity, and feelings of failure. It is important that nurses participate in self-care practices, recognizing the areas over which you have control and can change and those for which you do not have responsibility is a vital insight. Please review Box 38-7, Evidence-Based Practice. Impact of mediation therapies on illness-related stressors, as a supplement to this PowerPoint. When stress overwhelms a person's usual coping mechanisms and demands mobilization of all available resources, it becomes a crisis. A crisis creates a turning point in a person's life because it changes the direction of his or her life in some way. The precipitating event usually occurs approximately 1 to 2 weeks before the individual seeks help, but sometimes it has occurred within the past 24 hours. Crisis intervention is a specific type of brief psychotherapy and has 2 specific goals. First, patient safety. Use external controls to protect the patient and others if the person is suicidal or homicidal. Second, is anxiety reduction using techniques so that a patient's inner resources are put into effect. Help the patient make the mental connection between the stressful event and his or her reaction to it. This is crucial because he or she is sometimes unable to see the whole situation clearly. Help the patient explore coping mechanisms, perhaps identifying new methods of coping. A person who has experienced a crisis has changed, and the effects often last for years, or for the rest of the person's life. The final stage of adapting to a crisis is acknowledgement of the long-term implications of the crisis. If a person has successfully coped with a crisis and its consequences, he or she becomes more mature and healthy, shown as Figure 38-7, Crisis Intervention Model. Case study continued. Listed on this slide are the goal and expected outcomes discussed earlier. How can Becky assist Rachel in becoming successful at meeting her goals and outcomes? Becky should do the following to assist Rachel. Encourage Rachel to identify a realistic description of her changing roles. Use a calm, reassuring approach. Assist Rachel with developing an objective appraisal of her situation. Explore with Rachel previous methods of dealing with life problems. Explore Rachel's previous achievements. And encourage Rachel to identify her own strengths and abilities. Nursing process. Evaluation. A patient recovering from acute stress often spontaneously reports feeling better when the stressor is gone. Observe patient behaviors and talk with the patient and family if appropriate. Ask the patient about sleep patterns, appetite, and ability to concentrate. Ask about coping strategies that the patient uses and determine their effectiveness. Ask patients to compare current feelings and behaviors with feelings and behaviors 6 months ago. If desired outcomes have been met, the patient reports feeling better now than 6 months ago. The nurse should be actively involving patients and families in the processes of problem identification, prioritizing, goal setting, and evaluation. Engaging the patient as a partner in healthcare creates open communication. If he or she reports continued acute stress, assess for safety by asking about whether or not there have been any recent accidents at home, in the car, or at work. Ask about coping strategies to determine if the patient is using unsafe, maladaptive strategies. Ask about coping mechanisms used. An essential part of the evaluation process is collaborating with patients to determine if their own expectations from nursing have been met. Any revision in the plan of care includes steps to address patient expectations. Please review Figure 38-8, Critical Thinking Model for Stress and Coping Evaluation, as a supplement to this PowerPoint. Case study continued. Rachel has taken steps to manage her stress. She appears less anxious. She is eating healthy foods and is no longer drinking to reduce her stress. During the past week, she began to sleep through the night. She has resumed a friendship with a neighbor. She now asks for assistance from her husband at home and her coworkers at work. Becky should now consider helping Rachel locate a support group to provide further support.